Good morning, and welcome to another edition of Medical Minutes. I'm Dr. Peter Russotto, your host and moderator. Today's topic, physical therapy for the joint replacement patient. With me today is Larissa Sorrells. She's from Passavant Hospital Rehab Services. Larissa has received her doctorate in physical therapy and is also a certified trainer. As we have a population living longer with more active lifestyles, we put more physical demands on our bodies, therefore increasing the numbers of joint replacements in the United States. Advancements in surgical technique, better implants, and better perioperative physical therapy has increased the surgical cases and produced better and more functional outcomes. Larissa is here today as the expert to talk about the role of physical therapy and its importance in decreasing complications and improving the post-op course. In reality, it is a team approach. The surgeon, physical therapist, and patient all need to work together for these good functional outcomes, which also improves the patient's quality of life. So, welcome, Larissa.
Thank you for having me.
When we start this conversation, first of all, how many joint replacements does Passavant do in a year?
Well, last year we had 48 hip replacements, 175 knee replacements, and 1 shoulder replacement.
So we do upper and lower, but again, predominantly lower extremity
Yes.
replacements.
Mm-hmm.
And those are done by just the orthopedic surgeons, correct?
Yes, that is correct.
In the realm of the surgical theater, we always want to prepare a patient. What things can a patient do to prepare for surgery that will maximize their outcome when we're talking about joint replacement?
Well, there have been some great studies come out recently, and one of the biggest things that someone can do to improve their outcomes will be to quit smoking. And most of the studies say it needs to be like a 6-month timeline that they need to quit smoking before surgery. But don't let that deter you if you're still smoking and your surgery is in 2 weeks. Any time before surgery you can stop, and that will help your outcomes. Another thing you can do is your pre-op exercises. And that will really help your body be prepared for after the surgery to know what kind of exercises and what kind of muscle movements will I need to be doing after this is over. And then another good thing they can do is prepare for their home arrival. So, for instance, moving furniture out of the way, clearing paths if you're going to be using a walker, maybe getting all the right equipment and having it set up in the home.
When you talk about making your home safe, one of the things I've heard about is to actually remove all throw rugs, correct?
Yes, that's a great idea. If you're using a walking device like a walker or a cane and it's something you've never used before, getting everything out of the way is a great idea because a fall is one of the worst things that can happen after you have a joint replacement.
And being a podiatrist, I recommend having a good pair of shoes. None of these flip-flops or slip-on shoes, those will predispose you to a fall, especially after any joint replacement surgery.
Yes, definitely.
You talked a little bit about maybe preoperative exercises. Do patients ever get sent to you for specific, maybe to work on their quads or hamstrings because those might be either tight or loose?
We do see that a lot. The orthopedic doctors do send patients to therapy to try therapy before they decide on a total joint replacement. Now, the exercises that we give you in therapy are also really good to do up until the date of. So if you've gone to therapy in the past, say 6 months before a joint replacement, those exercises can be used up to the date of your service also. So if you're going to get a joint replacement and you have a sheet from therapy 6 months ago, go ahead and break it out and go through those exercises again.
And you say that there are studies that support exercises before will enhance the outcomes after the surgery.
Yes, most definitely. And I attribute that to muscle memory. So if we have to reteach your quad how to contract after surgery and we have to teach these muscles how to contract again, if they haven't done that specific motion in such a long time, as opposed to doing it 2 to 3 weeks before surgery, then that will make a much better outcome in the end.
We talk about different settings for physical therapy, such as inpatient, TCU, home health, outpatient. Can you talk a little bit about that for our listening audience?
Sure. So right after your surgery, you're going to be considered what we would call inpatient. And in the hospital, physical therapy and occupational therapy both come see you. The next day, then we decide on how you're going to be going to your next level of care. Will you be headed home? Will you be going to our transitional care unit? Will you need some type of long-term care, like a nursing home or something like that? And at that time, you and the doctor will decide where your next step will be. We have the transitional care unit, which is a place you can go and stay and focus on therapy. And you could also head home and have home health therapy come into your house, which is an option a lot of people use. And besides that, we have outpatient physical and occupational therapy that you can come to directly out of the hospital. So the doctor will help you decide what's best for your situation.
So basically what I'm hearing you say, both the pre-op, post-op is truly tailored to what that individual needs. Some people might need more physical therapy, some people might need less, correct?
Yes, most definitely.
Is there anything difference where maybe somebody's coming in for their second joint replacement, meaning the opposite extremity? Mm-hmm. Is there any more physical therapy or less? What would you say on that?
Well, we see that a lot, and the truth about that is each joint is different. So you might have had a great time with one knee and had a little bit of a struggle with the second knee that's been operated on. So we do take each individual joint to its own pace and what it needs to do too. So, for instance, we might keep you for 3 weeks after the first joint for your inpatient and transitional care stay. The next time you might only need 1 week. So it just depends on how well you're doing, but it is a lot easier the second time around because you know what to expect.
Also, you talked, I should say, a little bit about hip replacement. It's not uncommon that after a hip replacement, somebody might experience a limb length discrepancy. Mm-hmm. And that's where physical therapy can come in and maybe post that one limb that's shorter to make sure that the person doesn't have, uneven gait, correct?
Right, definitely.
And even tight muscles or anything can cause a somewhat of a structural limb length inequality. Why is it going for physical therapy after total joint replacement so important? What would you say is the overall number one thing why it's so important?
Well, what we aim for with your therapy and your goals is for you to get back to the highest level of functional mobility possible. So, if we don't make goals for you to get back to something that you wanted to do, how will you ever know that you've gotten there? And that's where physical therapy steps in. So we'll say, after you've had your knee replaced, I have a patient just like this. Her goal is to return to walking for exercise. And so in physical therapy, I have made her goals set up so that we can get to that end range goal of returning to walking for exercise. So I think that it's very important to know what your goals are, and that's what we do in therapy. We make goals for you, and then we take the steps step by step to get there.
One of the things we didn't touch on, and a lot of times the listening audience, when they see me out and about, they'll ask, is it covered by insurance? And I would say probably most insurances, including Medicare, does cover physical therapy, correct?
Yes, and Medicare does have what's called a physical therapy cap. Now, that is a $1,900 cap. It's like $1,960 this year, I think. So we keep track of that to make sure that no one goes over their cap when you come to see us for physical therapy. And you do have, Medicare will pay 80%, and then you might have a copay with that, or your secondary insurance might take care of it.
One of the positive comments I've heard from many patients, even after going through joint replacement, which sometimes is painful, but then they go through the physical therapy afterwards, a lot of times they'll say, my gosh, the physical therapy has improved my overall function for everything. Mm-hmm. They feel they have more stamina, more strength, more balance, more stability, correct?
Yes, most definitely. And I think that's attributed to we don't just focus on the one joint. We don't just say, okay, you're here for your knee, let's only do knee exercises. We look above and below the joint, and we also do some total body function things because we want to get you to that highest level of functional mobility possible.
Speaking of that, that's sort of like the old adage, the hip bone's connected to the thigh bone.
Yes,
and so that's why it's so important. And I know as a physical therapist, you also talk about core strength. That's even important, even though you're only operating on an extremity, whether upper or lower or one joint. Core strength is very important in all this.
Yes, it is. That's true.
Great information. Is there anything else that you wanted to add or discuss with the listening audience?
I think the main thing you need to remember is just try and be positive about the entire situation, and if you ever have a question or a concern, feel free to ask. Ask your therapist, ask your doctor, because we want to know what you're concerned with, and we also want to know what your goals are. So make sure that you include that in your conversations.
Well, thank you, Larissa, for coming and providing your knowledge and your expertise. It's great information. To you, the listener, thanks for tuning in this morning, and good health.